Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be completing the topic nucleic acid therapeutic agent. So it is the second session of this topic. So starting with the topic, so here as I mentioned in the earlier session also, that we will be focusing on the antiretroviral therapy, because majorly most of the nucleic acid therapeutic agents are actually implemented in ART. And talking about ART, antiretroviral therapy is a type of therapy which is mainly utilized for treatment of AIDS, that is acquired immunodeficiency syndrome caused by HIV virus, that is human immunodeficiency virus. Okay, so before like we cannot directly go into ART and the nucleic acid therapeutic agents, right? So we need to know a little bit about what is HIV. Okay, now what is HIV or what is AIDS? So see, the name of the disease is AIDS and the name of the virus is HIV. Okay, so don't get confused between the two. So if you say if you want to say that this person is suffering from um, this particular disease, then you need to say that this person is suffering from AIDS. Okay, you cannot say that this person is suffering from HIV, because HIV is just the name of the virus. Name of the disease is AIDS. Okay, so that is something that I want to clear in the first place. And then this, in this slide, as you can see, it is showing you in the form of a pie chart the different transmission categories of AIDS. So AIDS is majorly a sexually transmitted disease. Okay, but there are other different types of physical contact, direct and indirect physical contacts, by which AIDS can be spread. Okay, so that is what is given over here. So see, sexual contact covers the major portion. Okay, and mostly male to male sexual contact, means homosexual contact. Okay, so 53% will be through male to male sexual contact. 3% will be male to female sexual contact and injection use. Others will be 1%. Injection drug use will be 17%. Okay, injection drug use means when you are utilizing the same injection to give drug to multiple patients, which is mainly seen in case of the drug abusers, because they can arrange only one injection, and utilizing that injection they are giving like they are taking the drug dose, maybe 6 or 7 people are sitting together and they are sharing the same needle. So that is a major source of transmission of HIV. Okay, and also high risk heterosexual contact, which will be again 32%. Okay, heterosexual contact means female male sexual contact, which is high risk, means unprotected. Okay, without using any kind of protection. Okay, so now the in the next slide, I will just like to give you a brief overview of how this HIV virus looks like. So see over here, they have given the word virion. Now what is virion? Virion is the infective part of the virus. Okay, so HIV virus is a entire total virus, but we are concerned only about the infective part of the HIV virus. So hence we are saying we are studying the structure of only the HIV virion. So see, this is how the virus looks like. It looks beautiful, isn't it? So this is the and the most important part about HIV virus is that it is a RNA virus. Okay, so the genetic material will be RNA. So this is the RNA genome that is there, and this is the reverse transcriptase enzyme, which is also a very important part of the HIV variant. Okay, this is the integrase enzyme, which is again a very important enzyme. Then we have the capsid. Okay, this blue colored coating is the capsid. This is the matrix. We have the lipid membrane, we have the nucleocapsid. Then we have the different glycoproteins, which are very important. Among them, the most important glycoproteins will be GP120 and GP41. GP120 will be the docking glycoprotein, means it will be responsible for getting itself attached with the T helper cell. So that is the docking glycoprotein GP120, and GP41 will be the transmembrane glycoprotein, which will be present on the membrane, on the cell membrane or the cytoplasmic membrane of the virion. Okay, now coming to the HIV replication cycle, because when we will be talking about the different therapeutic agents, different nucleic acid based therapeutic agents utilized in AIDS treatment, before that we need to know that how this HIV virus actually replicates. Okay, So see, there are various steps. Number one will be binding and fusion. So here the variants GP120 and GP41 proteins will bind to the cell surface receptors. What cell surface receptors? The CD4 plus helper T cells. Okay, and that will be either the CCR5 or the CXCR4 co-receptor. Then the viral membrane will fuse with the cell membrane and the viral contents will be released into the cell. Second step will be reverse transcription and integration. Means here the two important enzymes will come into play, reverse transcriptase enzyme and integrase enzyme. So what we will do, what they will do, the reverse transcriptase enzyme, it is used to copy the viral RNA into the viral DNA. Okay. The viral DNA will be transported into the cell nucleus and it will be spliced into the cell's DNA by the HIV enzyme integrase. So now it will just go and integrate itself with the DNA or with the chromosome of the cell. And then the viral DNA will be persisting in the latent state until the cell activation. And the latent period of HIV virus can last up to 10 to 15 years, which is the most, you know, dangerous information or dangerous aspect of HIV virus. Okay, that if a person gets infected with HIV virus today, maybe he will come to know about it after 8 to 10 years. It varies. Okay, so the latent period is huge in case of HIV virus. Third step will be transcription and translation. Means viral DNA has already been formed with the help of reverse transcriptase enzyme and it has already become a copy of the it has already become a part, it has already integrated itself into the DNA of the CD4 plus helper T cell. So the main thing is done now. Now it is just sitting and resting and waiting to infect that person. When it will start infecting? When it will undergo transcription and translation, because then the new viral proteins will be synthesized and they will be forming the new viral particles, that is new variants, isn't it? So upon activation of the infected cells, means once the latent period is over, now the viral DNA will be transcribed into mRNA and the genetic material for the next generation of HIV. So the mRNA will be transcribed into the viral proteins and the enzymes by utilizing the cell, cell synthesizing machinery or the biomachinery of the um, host cell, that is the CD4 plus T cell. Okay. Now next step what will be? Assembly, budding and maturation. Means all the viral particles have already been transcribed and translated. Now they will just assemble themselves together and form the new complete variant particle so that it can go on and infect the other neighboring cells. So HIV proteins or enzymes and viral RNA will assemble into new viral particles. Viral will burst from the cell, means the cell will just burst open and the viral particles will be released outside the cell. The protease enzyme will cleave the long protein strands into small functional HIV proteins and enzymes. Mature HIV particles will now be able to infect the other cells and replicate. So that is the replication cycle of HIV. So how the HIV is infecting with the help of GP40 and GP120, GP41 and GP120, and how it is becoming a part of the chromosome or DNA of the CD4 helper T cell with the help of reverse transcriptase and integrase enzymes, and then it is going on multiplying and replicating. The new viral particles are formed, then it is getting outside the cell and it is going on and infecting the other cells exactly like before. So this concept is clear. Now we will be starting with the main content of today's session, that is the antiretroviral therapy or ART, where we will be utilizing different nucleic acid based therapeutic agents for controlling this HIV virus. Okay, so in ART, we will be using different antiretroviral drugs to treat the HIV disease. So it is also known as highly active antiretroviral therapy, that is HART regimens, which combine several antiretroviral drugs. So basically it's a combination therapy which we have already also seen in bacterial diseases like TB, which is known as DOTS, okay, where we are utilizing a combination of various antibiotics to treat tuberculosis. Okay. So to be successful, antiretroviral regimens need to contain at least two and preferably three active drugs from multiple drug classes. Okay. Now, what will be the primary goals of ART? Number one, reduce HIV related morbidity and prolong survival. Morbidity means the death rate, and prolong survival means to extend the life expectancy of the person. Because there was a point of time where HIV hua hai matlab that person will die, there is no treatment. But now we are coming up, since with the advancement of technology, with the advancement of medical science, we are coming up with various antiretroviral drugs which can actually not only prevent the morbidity of the patient, but also extend its life expectancy, his or her life expectancy. Okay, improve quality of life. Quality of life means it's not only that person will remain alive, but also that person will be able to live a free life, a healthy life. Okay, so that means enhancing or improving the quality of life, because otherwise maybe that person is free from HIV, free from AIDS, but maybe all through his or her remaining life, that person will be confined to the home or confined to the bed, because maybe his or her immune system has weakened to such an extent that even if he goes outside from the home, the normal germs that are there outside in the air, in the environment, that will make a huge harm to that person. So that thing is again not expected, because that means the quality of life is not there. Okay, only the life is there, but there is no quality. Okay, so that thing is also should be kept in mind. Restore and preserve immunological function, very important. Okay, because HIV हुआ है मतलब AIDS हुआ है मतलब the immune system is totally broken. There is complete breakdown of the immune system. So now when that person is recovering from that condition, it's very important that he or she gets back the original immune system that he or she had originally. Okay, so that is again an important aspect. Maximally and durably suppress the viral load, again very important. What do you mean by viral load? Viral load means when how much of virus has multiplied, has replicated inside the body of that patient. That means the viral load. So higher the viral load, higher will be the risk of the person to succumb to that particular virus, isn't it? So when we are treating that person with ART, when we are applying ART for that person, we also need to monitor that the viral load is diminished at the maximum level. Okay, the viral load is suppressed as much as it could be. Prevent vertical HIV transmission, very important. What is vertical HIV transmission? Vertical HIV transmission means transmission of HIV virus from the mother to the fetus to the newborn during birth. Okay, and mainly, especially if it's a natural birth, because in natural birth what happens, there is mixing of blood, and if the mother is HIV positive and if her blood mixes with her baby, then high chances is there that the baby will also become HIV positive. So that will also be an important goal of ART, that is prevention of vertical HIV transmission, because there are many cases day to day in India where in a delivery the mother is HIV positive. Okay, so preventing vertical transmission of HIV is also a very important goal or perspective of ART. Okay, now moving forward to what are the different ART drug classes and their mechanism of actions. Now there are different drug classes, but we will be mainly focusing on the nucleic acid therapeutic agents. Okay, because over here we are not talking about HIV or AIDS, we are talking about the nucleic acid therapeutic agents, isn't it? So we will be focusing only on those classes which are basically the nucleoside therapeutic agents. So number one will be the NRTIs, which the full form is nucleoside reverse transcriptase inhibitors. So basically they will be inhibiting the reverse transcriptase enzyme of the HIV virion. Okay, from the name only we can understand. Why? Because this reverse transcriptase is the enzyme which plays the first prior role in converting the viral RNA, in converting the viral RNA to viral DNA. Okay. So what this particular NRTI will do, that is nucleoside reverse transcriptase inhibitor, will do, it will block the reverse transcriptase enzyme before HIV genetic code combines with the infected cell's genetic code. So before combination happens, the NRTI has to do its job. Otherwise, it's of no use. Once the combination has already occurred, then if you are giving NRTI, that is of no use. Okay. So it will mimic the building blocks which are used by the reverse transcriptase enzyme to copy the HIV genetic material. So it will thereby disrupt copying of the HIV genetic code. So that is the main mechanism of action. So it will just go and mimic those building blocks which the reverse transcriptase enzyme will use to copy the viral RNA into the viral viral DNA. Okay, so if it's just mimicking, then obviously the genetic copy will not be formed. That is the mechanism of action. Second class of drugs, ART drugs, that we have is NNRTIs, that is non-nucleoside reverse transcriptase inhibitors. Okay, so those were the number one. NRTIs was the nucleoside and these are the non-nucleoside. That is the basic difference. Okay, so what they will do, they will block the reverse transcriptase before the HIV genetic code combines with the infected cell's genetic code, and it will physically prevent reverse transcriptase from working. So in NRTI, the reverse transcriptase was working. It was performing its function, but it had no idea that it is now copying a inhibitor rather than the genetic code. But in this case, it is directly going and blocking the enzyme itself. So the enzyme is no longer active. So obviously no question of copying the viral RNA into viral DNA. Okay. Now, there are some other ART drug classes also which are not of our importance in this topic, since again we are not talking about HIV or AIDS treatment. Okay, so there I will just mention the name for you. They are protease inhibitors or PIs, fusion inhibitors or FIs, and integrase inhibitors, that is IIs. Okay, this will not be inhibitors. This will be integrase inhibitors. Okay, I will just try to write it. So what will this integrase inhibitor do? It will just go and inhibit the integrase enzyme that is there, which is responsible for integrating the viral DNA into the DNA of the host cell, that is DNA of the CD4 plus T cell. Okay, so it will not be inhibitors, it will be integrase inhibitors. Okay, so now moving forward, now what are the current antiretroviral medications that we have that are in use? Obviously, the NRTI and the NNRTIs only. Okay, so talking about the NRTIs, that is the nucleoside reverse transcriptase inhibitors, we have apacavir, didanosine, emtricitabine, lamivudine, stavudine, tenofovir, and zidovudine. And among the NNRTIs, that is the non-nucleoside RTIs, which will just physically go and block the reverse transcriptase enzyme, we have delavirtine, we have efavirenz, we have etravirine, and we have nevirapine. Okay, now initial ART will consist of the most extensively studied combination antiretroviral regimens for treatment of the naive patients. Okay, naive patients means patients who are still in the latent phase, patients who have still not yet started to express the typical symptoms of HIV. Okay, what are the typical symptoms of HIV? You will have cough and cold, you will have intermittent fever, okay, you will have rashes and boils on the skin, okay, and you will have various associated fungal infections like Candida albicans, you will have cytomegalovirus infections, you can have genital herpes. Okay, so these are the different clinical symptoms of HIV. So when the patient is at the naive stage, means not yet started to express the typical symptoms, then we will go for initial ART, which will be combination of various antiretroviral regimens. What will be they be? Two NRTIs plus one NNRTI, means two nucleoside reverse transcriptase inhibitors along with any one non-nucleoside reverse transcriptase inhibitors, means just in order to be foolproof that either the enzyme itself will be blocked or it will be going and mimicking the genetic code. Okay. Yeah, and the second option is we can use two NRTIs, means two nucleoside reverse transcriptase inhibitors with a PI. with a protease inhibitors with or without ritonavir boosting. Means we can use, along with that we can use a ritonavir to boost it, or we cannot use also. Two options we have. Okay, now there are several advantages of the NNRTI classes, means the non-nucleoside class. What are the advantages? Okay, so number one will be save the PI options for future use. PI means protease inhibitors. So protease inhibitors are something, because when will be they required to cleave the protein, to cleave the viral protein, isn't it? So the viral protein will be formed at a later stage, when already this replication, transcription, translation, everything has happened. After that the viral proteins will be there to be cleaved, isn't it? So we need to think of something before that. So basically these NNRTIs, these non-nucleoside reverse transcriptase inhibitors, they will be saving the PI options for future use. Means if they fail, then we can go for the PIs and the IIs and the FIs. Okay. Long half lives, they will be available inside the body for a longer period of time after injected, and there will be less metabolic toxicity. Metabolic toxicity produced by these NNRTIs will be less compared with the other PIs, means the protease inhibitors, like hyperlipidemia, insulin resistance. These will not be there, or even if there, they will be at a much lower rate than in comparison to PIs. Okay, so these will be some of the advantages of NNRTIs. Now, what are the disadvantages? Number one, low genetic barrier to resistance. Single mutation confers resistance. Means if there is any kind of mutation in the HIV variant, then it will be of no use. NNRTIs will be of no use because the mutated virus will become resistant. Okay. Greater risk for resistance with failure or treatment interruption. Means if the treatment, if the duration of the course is not proper, say maybe due to some lagging behind of the patient, due to some misinformation of the patient or the patient party, if the course is not done properly, then the chances of mutation will be even more. Cross resistance among approved NNRTIs. Cross resistance means the same strain, but they are, transmitting resistance among the different strains of the virus. Okay, that is cross resistance. Skin rash can be one of the symptoms or side effects, adverse side effects you can say. And potential for CYP450 drug interaction. CYP450 is a receptor present on the CD4 plus T cells. So that receptor can go and start interacting with the drug, which can also be a great disadvantage. And also transmitted resistance to NNRTI is more common than resistance to PI. So NNRTIs are more prone to become resistant, means HIV virus is more prone to become resistant to NNRTI than PIs. Now talking about dual NRTIs advantages and disadvantages. Dual means when we are utilizing both two. So some of them will be advantages and some of them will be disadvantages. What are the advantages? Established backbone of combination therapy and minimal drug interaction. So there will be minimum amount of drug interaction, which is a very important advantage, and it will be having a established backbone of combination therapy. Means when we are utilizing both NRTIs and NNRTIs. And disadvantages will be that lactic acidosis will be there, means accumulation of lactic acid, which will be causing toxicity in the body, and hepatic steatosis. Hepatic steatosis means fatty liver, especially when we are using stavudine, dedanosine, and zidovudine, which are three types or three examples of NRTIs. So these will be the disadvantages, means adverse side effects, nothing else. Okay. So that was an overview of the major types of nucleic acid based therapeutic agents that we can use for antiretroviral therapy, mainly in connection to AIDS treatment. Okay, so I hope that's helpful. We will be moving on to the next topic very soon. Till then, thank you, goodbye. Please like, share and subscribe ITLS Academy.